So ask anyone what one of the main aims of the Tory party really is, and I think we can all agree on one thing, and that, quite frankly, is underfund something to a point where you can just privatise it. And quite frankly, many people in the Tory party are sitting there looking at all the stuff that's gone wrong, even though it's the government's fault and their direct result of not doing any disaster planning in any way, shape, or form. And the main guy who was in charge, Boris Johnson, is directly responsible, as well as members of his cabinet and his party, who essentially just did nothing. They just sat back and watched. But this concludes to a massive part that we know that the Tories are rather famous for, and that is, you let something fail, and when it fails, it's a perfect point to go, well, guess we have to privatise it now. And that is what is really worrying. And today, this comes from the New York Review, or the New York Review Daily. And the title of the article is "The Pro-Privatization Shock Therapy of the UK's COVID Response." There are plenty of things people will say we get wrong. Britain's Prime Minister Boris Johnson said of the nation's coronavirus response in a recent speech, "In one of the world's worst affected countries, much of the focus has been on the government's mismanagement. Johnson's inexperienced cabinet, selected for fealty over Brexit before anything else, has proved inept and completely out of its depth. With Downing Street's inner circle dominated by hardliners of the Vote Leave campaign, the response to the crisis was botched, neglectably slow, and Brexit preoccupied diverting resources from pandemic planning before any official inquiry is underway. Many regarded Johnson himself as ultimately responsible." Quoted in a damning investigation by the UK Sunday Times newspaper in April, a senior advisor to the government condemned the Prime Minister's fecklessness. He said, "He didn't do urgent crisis planning. It was exactly like people feared he would be." Britain's official toll of COVID-19 deaths has passed over 44,000. Going into lockdown late has cost thousands of lives, releasing potentially infected hospital patients into elderly care homes, exposed the most vulnerable to risk. More than 1 in 20 of nursing home residents are believed to have died from the COVID-19, a figure roughly 13 times higher than for the same population in Germany. But severe and serial mismanagement of the crisis has been disastrous, as it has been concealing a deeper failing, one driven by ideology. Boris Johnson won last year's December election on promises of Brexit, but also state investment and levelling up neglected regions of the country. And yet, facing the coronavirus, his party insisted was to shore up the private sector, a pandemic version of disaster capitalism. To borrow Naomi Klein's Coring from her 2007 book, The Shock Doctrine, Britain's public health sector was cash-strapped, eroded, but a functioning network comprised the National Health Service, the general practice clinics, the local authority, health officials have been repeatedly sidelined in favour of outsourced alternatives. As Alison Pollock, a professor of public health at Newcastle University, put it to the New York Times recently, they're basically trying to build a centralised, parallel, privatised system. This is happening even as scientists and health experts urge the government to use the existing, practiced and more effective public sector. It happened while the UK media reports from countries that got a better grip on the coronavirus, from Germany to the Indian state of Kerala, showed the vital part played by public health care. I spoke to Dr. Tony O'Sullivan, our co-chair of the campaign group Keep Our NHS Public, who has said the pandemic has been exploited as an opportunity for those who have been trying to return the healthcare to the private sector, a long-standing project. Putting COVID-19 contracts in private hands has undermined Britain's coronavirus response at the beginning of the pandemic and leaves it still lurching today. Before the end of May, more than 300 NHS and nursing home workers had died from COVID-19, along with many transport and other essential workers. Dr. Abdul Mahbub Chowdhury, an East London-based doctor who died from COVID-19 in April at the age of 53, had warned about the lack of personal protective equipment, or PPE, 5 days before being hospitalised. By then, it was clear that Britain was struggling to provide these critical supplies. The government, still tardy in stockpiling, blamed the global shortages as countries raced to meet demand. But Britain's response was also hamstrung by decades of fragmentation and outsourcing, and a decade of pushing austerity cuts hit local government and public services hard. We Own It, a group that campaigns for social ownership of public services, reports that even prior to the coronavirus, NHS supply chains had been sliced into 11 procurement areas dealing with various private contractors, and it convoluted and often reliant on a just-in-time practices. This supply chain fell down in the face of the pandemic. In late March, trying to address the PPE shortages, the government brought in the army and also contracted with the regional distributor Clipper Logistics, whose chief executive, Steve Parkin, is an ardent Conservative who cites former Tory leader Margaret Thatcher as a hero and has donated over £700,000 to the party in the past 5 years. Throughout April, there were still reports that the system was still floundering and local authorities were having to make their own arrangements to equip NHS and care workers. The accountancy firm Tory was brought in to source equipment throughout the crisis under the direction of the Cabinet Office in Whitehall. According to manufacturers, this Ineffective provided to be a disaster. One factory owner told the Daily Telegraph, "It has been a nightmare to deal with Deloitte, since the firm did not understand how supply chains actually worked." Day after day, the government said it was open to all offers to help make protective wear. Some 8,000 PPE suppliers duly emailed the Cabinet Office, but never received anything more than an automated reply. Hiring Deloitte for the job was an error of judgment, according to a manufacturer, one of those offering to help, who spoke to the UK political website Open Democracy. "If there is a fire, you don't call the auditor, you call the fire service." The site reports that several manufacturers spoke of the sleep loss and anxiety caused by knowing that they could have done something to help if only they had been asked to. Early in the pandemic, the World Health Organization chief, Dr. Tedros Adhanom Ghebreyesus, had said, "Our key message is test, test, test," but Britain did not heed this advice. In mid-March, the official criteria for testing throughout the NHS extended only to hospitalised cases of infection and essential workers. The government failed to achieve the full network of laboratories at its disposal within the NHS, as well as in universities and independent research facilities. When the government did finally roll out wider testing months later, it again bypassed existing labs and set up 3 new mega facilities whose operations, managed by Tory under the banner of Lighthouse Laboratories, has been based on contracting arrangements about where there's little public disclosure. The Francis Crick Institute, a non-profit biochemical lab, was one of the many facilities offered to help. It swiftly created and published testing protocols, which were downloaded thousands of times. The institute can run up to 5,000 daily tests with the fast turnaround, but the government has shown little interest in its offer to help. "We were not taken seriously or any notice of," said Paul Nurse, the institute's director. "Officers from labs like his around the country could have made a significant difference at the height of the pandemic. He told me the infrastructure of biochemical science, a body that represents some 130 NHS labs, has also criticised the government decision to ignore the existing system for providing testing. It just seems perverse that we have to create this whole additional structure rather than looking at what there was in our own backyard. Its president, Alison Wilson, told Huffington Post, adding that it was hard not to see an element of political dogma at work. Unravelled amid much fanfare in early April, the mega lab ran into trouble within weeks. Privately contracted drive-through centres set up to take swabs for testing were hard to access and did not always produce usable samples. At one point, as many as 350,000 samples could not be readily matched to records because the drive-through centres had not logged people's NHS IDs, and some of the 67,000 samples were never sent to the US for testing in early May. Nearly 300,000 came back void. Reviving this testing programme, the Royal College of Pathologists has cited a damning list of failures: poor specimen taking, poor labelling, poor transcription of details, slow result turnaround, poor quality control, lack of the result returning to the appropriate person, inappropriate application of the result, the lack of critical input or even oversight. The logistics of sending swabs to faraway labs and results back to local authorities or hospitals itself creates margins of error, the sort that might be avoided through an existing public system where local governments and the NHS and doctors and surgeries are already connected. Sarah Calklin, the director editor of Local Government Chronicle, told me of the huge frustration amongst senior officers. Councils had leisure centres closed, libraries and other venues already existing in their communities where people could have gone to get tested, instead of the remote drive-thrus set up for the purpose. Directors of public health within local authorities say they were not consulted at all. It has all been done in a black box in central London, as one put it to me. All this meant that local authorities could not determine infection rates in their own districts, often finding out about outbreaks in their areas first from local media when the complete local event data first started to appear. It showed that councils had previously seen only the tip of the iceberg of infections. We spent the first part of the pandemic to well past the peak flying blind, with only about half of the confirmed cases viable in public domain. Dominic Harrison, Director of Public Health in Blackburn and in North West England, said that the issue is recently made national news after the outbreak of infections in Leicester forced the East Midlands city into a local lockdown. Leicester's mayor and public health officials said they had not received the Pillar 2 testing for their area, which meant that 90% of resident cases were detected by local facilities and were not continued into the national data. Like other local authorities, this council did not until recently have a postcode level data on infections, which is essential for controlling outbreaks. But testing was only half of the problem. Government mismanagement also hindered efforts to use this information to track the virus and limit its spread across the population. A fledgling minimal tracing operation that involved calling contacts of those to be found to be infected or ordering them into self-isolation was halted mid-March amid much criticism. Then, in early May, the government announced it was setting up contract tracing call centres that would be staffed by thousands and would work alongside a new tracking app. It was touted by the government ministers as world-beating. The system and hyperbole rhetoric that drew a response from the opposition leader Keir Starmer that effective will do. In the event, the system had not been cleared even this bar. The low-paid staff of the call centre companies Serco and Steele, who responded to the recruitment ads calling for a positive can-do attitude and a passion for customer services, have described chaotic training, unwieldy tech systems, and idle shifts for lack of COVID contact calls to make. Serco's appointment in particular raised eyebrows, both because the company was recently fined more than $1 million for failures on another government contract, and because Junior Health Minister Edward Arger is a former lobbyist for the company. Originally scheduled to be up to running in late June, the track and trace system will not be fully operational until September. In a leaked email, Serco's chief executive said he wanted the scheme to cement the position of the private sector in the NHS supply chain. Meanwhile, the government's much vaunted custom-built tracing app fluked. After 3 months of wasted development and time cost at least several £1 million, it has been abandoned in favour of existing technology from other developers, which is not clear when this version will be integrated into the government's track, trace and programme either. According to the British Medical Journal, by late June, local health protection teams had already traced 8 times more contacts than the outsourced call centres and online services had. Local authority expertise was obvious to anyone who knows anything about public health. Chris Ham told me, the former chief executive for an independent healthcare think tank, the King's Fund. He is now the chair of the Coventry and Warwickshire Healthcare Partnership Board, a not-for-profit that coordinates local government and health services in the Midlands. It is what they are trained to do, bread and butter to them, he said. It's about knowing your community, the science, the sociology and anthropology of different areas. It cannot be done nationally by people in call centres. Central government has now brought local authorities partly into the process, giving them extra funds, but until this point, Ham said, councils were banging on government doors saying, use us, we want to play our part, we know what to do. In recent online press conferences for a group of experts and scientists known as the Independent SAGE Group, Gabriel Sally, the former regional director of Public Health England, said that in a failure to make better use of public health and local resources would have had a significant economic consequences, as the UK would likely now be bumping along with continuing infection, with hotspots and flare-ups, maybe even a second wave, instead of investing in a proper, effective system. The Johnson government policy choices would create much more damage. Nobody knows the overall price tag for outsourcing, though some have said it stands at $1.7 billion. In private sector contracts has been so far disclosed. Full details are not public. Ian McGrill, the director of Open Ops, a group that monitors public sector contracts, has said there seems to be a feeling in the government that we can get away without publishing information. Some clues come from Professor Pallock and colleagues, who have noted that their annual budget for communicable disease control for Public Health England, an arm of the Department of Health that is leading the government's coronavirus response, was $87 million in 2018 and 2019. By way of contrast, Randux Laboratories won a month-long contract for analysing home testing kits worth more than $133 million alone. It was about political will, she said, at a recent event held by the Independent SAGE Group, a group of independent scientists that aims to provide transparent advice on the coronavirus outbreak. It is squandering hundreds of millions of pounds on contracts that are not going out for tender. The Conservative Member of Parliament, Owen Paterson, is currently paid £100,000 a year as a consultant for Roxanne, which won the contract unopposed. As Labour member Tan Desher reminded Parliament in mid-June, the government has suspended normal procurement rules for a competitive bidding process during the pandemic. And lo and behold, he said, major Tory party donors and prominent members on the government benches, including ministers, may I add, have had major shareholdings, are inextricably linked to many of these firms. Talking to me as described a slew of private sector pandemic contracts as purely ideological. In this case, it's not even privatisation through the back door, he said. Pillaging is taking place in full view. There is a larger game afoot in all this. The outsourcing bonanza has coincided with Britain's tense talks within the European Union over terms of a new non-member relationship. The Brexit transition period, during which Britain is still following the EU's, concludes that by the end of the year, negotiations to resolve the myriad difficult outsourcing issues have already been set back by the pandemic. Yet Boris Johnson has refused to countenance an extension. For Vote Leave hardliners, a no-deal Brexit is not unwelcome. It would, as they see it, set free the nation to forge ahead as global Britain, a sort of deregulated Singapore-on-Thames, as some Brexiteers have enthused. Others see this as a dangerous new shock doctrine. Parting ways with his increasingly hard Brexit party last year, the former Chancellor Philip Hammond wrote in the Times of London that Johnson's advisers see the shock and destructive of a no-deal Brexit as a chance to reorder our economy and society, coupled with a rolling back of the welfare state through a handout of pandemic contracts to the private sector. This bonfire of regulations represents an extension of Thatcherism, a chance to finish what she started. Although Johnson himself is an opportunist, ambivalent, and won the last election on part of promises of lavish public spending in favour of Britain's left-behinders, this harder edge political ethos runs through his administration, even short of Britain's crashing out of the EU in a hard Brexit is a bare minimum trade deal with his former European partners would leave the UK seeking to deepen trade relations with other countries, especially the US, where disdain for freedom-crushing big government and red tape is the inspiration for many in the now ascendant right of Johnson's Conservative Party. But if the ideological appeal to Downing Street of America is clear, the cost for practically everyone else will be considerable. Modern trade deals are about so much more than tariffs. Nick Derlin, the director of the Group of Global Justice, told me they're about regulation and how you run the public services, what kind of food standards you have. For the US, a trade deal is contingent on opening up British markets in food, farming and pharma and health sectors, and this means battering down existing standards and protections that came with EU membership. With those lowered, standards in the UK would not be able to carry on trading in the EU market. The Conservative manifesto for last December's election promised not to compromise on Britain's food and animal welfare and environmental standards, but Johnson's government has since backtracked on those commitments, refusing to guarantee that chlorinated chicken from the US would stay off UK shelves, and refusing to amend a recently passed agricultural bill to include greater protections for British farmers. There is little scant public support for any of this. In recent polling, the vast majority of Britons are unwilling to accept the lower quality US imports, but since the Conservatives have an 80-seat majority in Parliament, and since the government last year scrapped powers for parliamentarians to scrutinise post-Brexit trade deals, there is no legislative mechanism to scrutinise or even stop any trade deal. The country is now headed for a post-pandemic recession, which the Organisation for Economic Cooperation and Development forecasts are likely to be one of the worst among the major economies. According to pro-Brexit analysts recently cited by the New York Times, the government could bury the shock of Brexit and may entail a no deal so it can default to WTO terms in a generalised pain of the pandemic. But, as one Scottish Nationalist Party member gloomily predicted in Parliament in early June, it is going to be misery heaped on misery, as COVID and Brexit appear like the twin horsemen of the economic apocalypse, trampling over any prospect of a recovery. And that's, once again, where we unfortunately are. We are, as quite frankly there, screwed. And what should be really shocking is that line that from that CEO to cement themselves into the NHS supply lines. Also, that should be highly noted there, the fact that we were using just-in-time delivery systems. What ends on the 1st of January 2021? Just-in-time delivery systems. So, this is going to be an absolute disaster. And I've had people, even one person in particular, one person of a Scottish accent, said to me, the NHS will never never be privatised. It's too big. Here you have an exact case of what I said was going to happen. It will just be cut up and sold off piece by piece. Doesn't matter, because someone's going to get a lot of money, and it's going to cause a lot of damage to people like you and me. But like I say, at the moment, there is nothing we can actually do. And that's the terrifying thing. I'm hoping that in the next election, the Conservatives get absolutely spanked completely, and I mean wiped out. I really hope they do, because then we can start to undo some of the changes that they're trying to force on this country. And as usual, the headline of, you heard it mentioned there, Singapore-on-Thames, rears its ugly head once again. That is not what the people who voted for Brexit actually voted for. Indeed, many times when this has actually been put to people who were Brexiteers, they have balked at that notion of what the Conservatives actually want to do. So remember, guys, when they're all saying, oh, this is what people wanted, this is the will of the people, it'll be funny to see how that line gets spoon-fed to you all when you were the ones trying to say, when we were warning you against what this was happening, and you were trying to spoon-feed this line to us. Well, you've only got yourselves to blame for this. This is what you voted for.